Okay, just like usual, just go to the radiology department according to your appointment. Just wait there until your radiographer will call your name. So for example here, check the patient name. Is it true that your name is Abdul Rahman bin Wahid? So if true, ask the patient to sign the consent form while asking if the patient really fast for at least 4 to 6 hours prior to examination. So ask if he already took the laxative that the nurse give, and then explain briefly to the patient about what we going to do today, so that he will understand it, so it will make the procedure become more smoothly. And then ask the patient to change the outfit at the changing room before the examination. While waiting for the patient to change, the radiographer can set up the exposure factor and choosing the correct size of the cassette before we use. So for this examination, for the abdomen, we use the cassette 35 x 43 cm or 10 to 12 inches. We put it in vertical orientation, not in the horizontal. So then don't forget your anatomical marker.
Knock the door to call the patient out. Ensure that the patient must be wear hospital gown before performing the examination. So then, when the patient is out, lead the patient to the room. Here, then you can explain to the patient to be in a positioning. So now go to the positioning first. Ensure patient remove the shoes, and then now we need to ensure that patient safety to not fall down. So we are going to help the patient. Now patient in prone positioning, we're going to do PA projections of the abdomen. Align the MSP of the patient to the table to ensure the center of the patient is not tilting. Then cover the patient with the blanket. The center point of this projection will be at the level of iliac crest. Now go to free the table and then palpate the iliac crest. Once you find both of the iliac crest, you can use one of the iliac crest to identify as the point, and then move the table where the center of the point will be at the level of iliac crest, which is the midline or the midpoint of the level of the iliac crest. Collimate the patient which is superior at the diaphragm, inferior at the cervix pubis, and lateral at the skin margin. So marker which is left side will be put and must be flipped since this is the PA projection. Then we're going to put the marker which is at the appropriate side. So this is its place. Now you can tell the patient to not move and follow the instruction later. Now we go to the control console and ensure that the preset is suitable. If not, you can change. Instruct the patient about the breathing method. Now we're going to instruct the patient to breathe in, breathe out, hold a breath, and then we shoot. Now we're going to do AP projection of the abdomen. Now we ask the patient to turn around for the AP projection of the abdomen. Since goes to this one, cover the patient with blanket and adjust the patient. Ensure the MSP is centered to the center of the table. The center point for this projection is also the same, which is at the midpoint of the level of the iliac crest. So palpate the iliac crest and center at that level.